If you're struggling to stand up straight this morning because of a sharp pinch or a nagging ache in your lower back, do not give up on your day yet. That stiffness isn't old age, it's your muscles in guarding mode, and we are going to unlock them. Today, I'm giving you 4 instant relief techniques designed for the senior body. No floor work, no equipment, and 0 sweating. If you have a sturdy chair and 10 minutes, you have everything you need to take your mobility back. I call these the quick releases because they target the pain at the source. We're going to unstick those nerves and get you moving without fear. If you have numbness or tingling down your legs, stop and call your doctor. Otherwise, grab your chair and sit up tall. Let's do this together. The first technique, gentle mobility and stretching. Our first goal is to stop guarding. When your back hurts, your muscles lock up to protect the area. We're going to gently coax them to let go, starting with the seated cat-cow. Sit at the edge of your chair, feet flat, hands on your knees. Sit tall. Inhale, arch your back, press your chest forward, and lift your chin. Feel that gentle curve. Exhale, round your spine, tuck your chin, and pull your belly button in. Imagine curling over a beach ball. Let's flow with the breath. Inhale, arching forward. Exhale, rounding back. Inhale, feel the spine wake up. Exhale, release the stiffness. 2 more. Inhale and arch. Exhale and round. Last one, inhale deep and exhale it all out. Great. Return to center. You've already increased the blood flow to your discs. Next, the seated hamstring stretch. Tight legs pull on your pelvis, which creates back pain. Stay on the edge of the chair and straighten your right leg. Heel down, toes up. Sit tall, hands on your opposite knee. Exhale and hinge forward from your hips. Keep your back perfectly straight, no rounding. We're holding for 20 seconds. Breathe deep. Every exhale tells your muscles it's safe to relax. Let's count. 5, 4, 3, 2, 1. Sit back up. Switch legs. Heel down, toes up, back straight. Hinge forward until you feel that pull. Hold it here. Breathe through the tension. 5, 4, 3, 2, 1. Slowly come back up. Those 2 moves alone can stop a morning flare-up in its tracks. The second technique, targeted core and glute activation. Now we wake up your support system, the core and the glutes. If these muscles are lazy, your back has to do all the work. Let's change that with the seated pelvic tilt. Sit tall with your hands on your hips. Imagine your pelvis is a bowl of water. Exhale, tilt the bowl backward, pressing your lower back into the chair. You'll feel your lower abs tighten. Inhale, tilt it forward to create a small arch. Let's focus on the backward tilt, your built-in corset. Exhale, tuck your tailbone and press back. Hold for 3, 2, 1, and relax. Again, exhale, tilt back, feel the abs fire up. 3, 2, 1, and relax. 5 more, steady reps. Tilt and hold, relax. Tilt and hold. Relax. Feel that internal support. 2 more, tilt and hold, relax, last one. And relax. You just taught your body how to protect its own spine. Finally, let's hit the glutes with the modified bridge. You can do this on a firm bed or the floor. Lie on your back, knees bent, feet flat. Step 1, squeeze your glutes tight. Step 2, press through your heels and lift your hips just 3 inches. Don't go for height, go for a solid squeeze. Hold for 5, 4, 3, 2, 1. And slowly lower. Again, squeeze first, now lift. If you feel this in your back, you're lifting too high, stay lower and squeeze harder. Hold for 5, 4, 3, 2, 1. And lower down. 3 more reps, squeeze, lift, and hold steady. And lower, squeeze and lift. Feel the strength in your hips, and lower, last one, make it count. Squeeze, lift, and hold. 5, 4, 3, 2, 1. Slowly lower and hug your knees to your chest. You've just given your spine the support it needs to get through the day. We're halfway through. Are you feeling a little bit looser already? If this is helpful, do me a quick favor and tap that like button below. It truly helps more people who are dealing with back pain find this video. Now, let's get to our third technique. The third technique: heat, cold, and topical relief. Our third technique isn't an exercise. It's about managing pain and stiffness directly with temperature and topical aids. Sometimes, the fastest way to feel better is to just calm everything down. This is all about knowing when to use heat and when to use cold. For a new, sharp pain or a flare-up that feels inflamed, cold is your best friend for the first day or two. Cold therapy works by shrinking blood vessels, which helps reduce inflammation and swelling. It also numbs the area a bit, which can dial down the pain pretty quickly. To do it safely, wrap a gel pack or even a bag of frozen peas in a thin towel. Never put ice right on your skin, and place it on the sorest spot for 15 to 20 minutes. Now, for chronic stiffness, muscle aches, and that general tight feeling, heat is the answer. Heat therapy does the opposite. It increases blood flow, bringing more oxygen and nutrients to the muscles, which helps them relax. Plus, it just feels so soothing. Using a little heat before you do your gentle stretches can make them even more effective. You can use a heating pad, a warm compress, or even stand in a warm shower. Apply it for 15 to 20 minutes, and be careful that it's warm, not hot, and never, ever fall asleep with a heating pad on. A quick but critical safety note: if you have diabetes, neuropathy, or any condition that affects your skin sensation, you need to be extremely careful. Please talk to your doctor before using heat or cold therapy. Beyond that, there are topical creams and gels. Products with menthol create a cooling feeling that can distract you from the pain. Others with capsaicin from chili peppers create a warming sensation and can help block pain signals. Always read the directions, and it's a good idea to check with your doctor or pharmacist before using them, especially if you have sensitive skin or take other medications. And a big one: never use a menthol cream with a heating pad that can cause serious burns. This technique is about giving yourself some quick, passive relief to calm the area down, making it easier to move. The fourth technique: positional relief and safe self-care. Our final technique is all about finding positions of comfort and using your own hands to bring relief. Sometimes, the quickest way to ease back pain is to simply take the load off your spine. First, let's talk about positional relief. One of the best and easiest positions is called the hook lying position. You can do this on the floor or on a firm bed. Just lie on your back with your knees bent and your feet flat on the floor, exactly like we did for the bridge exercise. That's it. Just being in this position takes some of the pressure off your spine and lets the muscles around it relax. To take it to the next level, you can place a pillow or two under your knees. Just resting here for 5 to 10 minutes, breathing slowly and deeply, can make a world of difference. Another great trick is a chair-based self-traction. This can feel incredible if your pain feels like everything is compressed. Sit tall in your chair and place your hands firmly on the seat, right next to your hips. Now, press down into your hands and use your arm strength to lift your bottom just slightly off the chair. Let your spine decompress and hang for a moment. You're using your arms to support your weight. Hold it for just 5 to 10 seconds, then gently lower yourself down. Let's try it again. Press and lift, letting your lower back get longer. Hold and lower. This can provide an almost instant feeling of space and relief. Finally, let's use our own hands. You know your body better than anyone, and you can often find the exact spot that's bothering you. While seated, you can make a fist and gently press it into the muscles on either side of your lower back. Never press right on the spine itself, always on the fleshy muscles next to it. You can make small circles or just apply steady, gentle pressure. A simple tennis ball is also a fantastic tool. Place the ball between your back and the back of your chair, right on a tight spot in your glute or lower back muscle. Then, just lean back into it to apply pressure. You can make tiny movements to massage the area. When you find one of those really tender spots, just hold the pressure there for 20 to 30 seconds while you breathe deeply. It's an amazing way to release deep muscle knots. These self-care techniques put the power to find relief right in your own hands. So, there you have it, 4 different techniques you can use right now to get relief from lower back pain. To make it super practical, here's a mini routine you could do every morning. Start with a warm pack on your lower back for 10 minutes. Then, do a few minutes of seated cat-cows and pelvic tilts right there in your chair. Finish up with the seated hamstring stretch. That whole routine could take less than 15 minutes and might completely change how you feel for the rest of the day. Consistency is everything. The more you work these gentle strategies into your day, the stronger and more resilient your back will become. If you got some value from this today, please subscribe to the channel and hit that notification bell. We have a whole playlist of senior-friendly exercises that you might find really helpful. And please share your experience in the comments below. Which of these techniques worked best for you? Sharing what works helps us build a community where we can all learn from each other. Waking up with back pain does not have to be your story. It doesn't have to dictate how your day goes. By using these 4 techniques, gentle mobility, targeted activation, heat and cold, and positional self-care, you now have a powerful toolkit. You have the ability to take back control, to ease your own pain, and to reclaim your life. Remember to listen to your body, always put safety first, and be patient with yourself. You took a wonderful first step today just by showing up and trying. Thank you so much for joining me. Stay active, stay safe, and I can't wait to see you in the next video.